Awareness Week, and it's so important that families struggling with infertility understand when it's time to seek a fertility specialist. Dr. Stephanie Singleton is a reproductive endocrinologist, and she joins us today to focus on male factor infertility. Dr. Singleton, thank you so much for joining us on Low Country Live.
Thank you for having me.
So let's just start with, defining it. What is male factor infertility?
Right. Well, it's interesting that most people think that infertility is related to the female because we're the ones that have the baby. But roughly 40 to 45% of infertility is actually related to the male side.
Wow.
And a lack of production of sperm, either a decrease in the numbers of sperm, a decrease in the movement of the sperm, or the shapes of the sperm. All of those things can contribute to making it harder to get pregnant.
Okay, so what are some of the things or the causes that would create, male infertility?
Right. It could be a past injury, it could be a genetic issue, a hormonal issue, it could be, a long-term medical issue. And oftentimes we find that we cannot find the cause.
Okay.
So, the fortunate thing is that even if we can't find the cause for it, we most often have a treatment for it and we can overcome that, which is most important, of course, in making a baby.
So, if a couple has been struggling for a while to get pregnant and it's not happening, what's the first step? How do they determine that it could be the male as opposed to the female? What do you do?
Right. We encourage them to just come in. Absolutely take that first step. This is National Infertility Awareness Month, and so we're really trying to get the message out to encourage people. I know they're trying at home. They're trying everything that they've read on Google and everyone has advised them, but come in, let us at least talk. Let's do the initial evaluations, which are pretty straightforward, so that you can find out if you have an issue and how to treat that.
And that's what we were discussing during the commercial break. Right. Sometimes it's so stressful and it's so hard, and it's really hard to take that first step, but that's what you're good at, welcoming people in just to talk about it. It's easy to take that first step.
Right. We try to make patients feel welcomed at the Fertility Center of Charleston. They're going to come in, we're going to sit down, we're going to talk about their history, we're going to help to explain the issues to them, we're going to talk about the testing so that they know what we're looking at, so that they know how much it costs, all of those things, no surprises, to try to make it as comfortable an experience as possible.
So, the woman, I think we tend to go to the doctor probably a little bit more
than
men.
Absolutely.
So if, as a woman we go and find out it's not us, is it hard to get the man in? You said nearly 50% of cases are male factor for infertility.
It does seem to be harder because, as you said, I think men just aren't as used to going in to the physician annually as we are as women. And we try to make that more comfortable for them. They can either come in for an evaluation, we have a collection room that, there again, we try to make it the least stressful possible, or we'll actually send them home with a sterile cup. They can collect it home. As long as they live within an hour of the Fertility Center of Charleston, they can then bring that specimen in and we can analyze it. So trying to make it as reachable, as attainable, as comfortable as possible for everyone.
Now, and if you do find that there is a problem with the male, how likely is it that you can actually treat it and do something about it?
Right. We can almost always, if we can get to sperm, then we can make a baby with that sperm. We have a wonderful technology called intracytoplasmic sperm injection, a big long word, we abbreviate it and call it ICSI, which means that we only need as many sperm as the female can make eggs in a given month. And so that means that we may only need 5 sperm or 10 sperm.
Wow.
A normal sperm count is about 20 million total motile sperm, but we actually require many, many fewer than that to actually make a conception. And so usually if we can find the problem, we can fix the problem.
Right. And we were saying, this is the Awareness Week, so if you're at home and struggling, a little nervous, this is a great time to go see you guys because you're offering free consultations.
Absolutely.
Where can everybody find you?
Right. If you can look at our website at fertilitycharleston.com, you can call us at 843-881-7400. We are welcoming free consultations if you schedule this week, just to try to get the word out, try to encourage patients to come see us and take that first step.
All right, Dr. Singleton, thank you for being here on Low Country Live so much.
Thank you.
And we will have more when we come back in just a moment, right after the break.